Europe's evolving data and artificial intelligence will impact open science. And the good thing about having these conferences online is that you have all the time to navigate the website, look at the news, look at the latest report. So do so. And in fact, this afternoon, we are shifting a little bit the focus of the conference compared to this morning. This morning was more about health systems and patient outcomes. This afternoon, we are going to focus on digital health and AI in health. So we will go, before we dive into the chase of it, I'll have the pleasure to welcome in a few minutes Commissioner Maria Gabriel, the European Commissioner for Innovation, Research, Culture, Education and Youth. She'll be joining us in just a couple of minutes. But before we welcome Maria Gabriel, we have also the pleasure to be joined by a representative from a patient organization, Kaisa Immonen, your Director of Policy at the European Patient Forum. And as we did this morning, I think giving patient organizations a voice in the work that we are carrying out has always been a very important thing. So can I invite you to give a few opening remarks and right before Commissioner Gabriel will join us. Kaisa, thank you for accepting to be here today. The floor is yours.
Thank you. Thank you very much for the introduction, and good afternoon to everybody. I'm very happy to be here to share a few thoughts with you from the patient perspective. You will have quite detailed discussions in this session, and I have only a few minutes before the Commissioner comes in. So I would like to address a couple of points at a slightly higher level. Really, my key messages are that patients' insights can add enormous value in producing innovative healthcare solutions. Patient data can and should be used more effectively, but its full potential can only be achieved in partnership with patients. Now, surveys show, also our own, that patients are generally happy to share their health data, even more than the general public, and they would actually like it to be used more effectively. However, several factors affect willingness to share, and these would include confidentiality and being sure you stay anonymous, knowing what their data is used for and by whom, being reassured that your personal data will not get in the hands of third parties, and this is particularly a concern for patients with chronic diseases about discrimination they face, and using the data for something that brings real benefit to patients. I want to say a few words about collecting data versus using data. There is this growing trend towards collecting various quality data in healthcare systems, including patient-reported measures at different levels of healthcare in a structured way using established indicators. But what is not at all certain, at least today, is that the data collection efforts are actually improving either patients' outcomes or their experience of care. There was a very interesting new study from the UK that showed how good intentions to embed patient-centered care in healthcare organizations or systems can lead to a commodification of the patient's experience and the collection of a massive amount of data through certain tick box exercises like satisfaction surveys, but there's little sense of whether or indeed how these data are actually used. We in the patient community have long been saying that patients' real-world insights, and this is also data, it's not only quantitative, right, can take many forms and therefore need a range of quantitative and qualitative approaches to really capture them. This is why, in the context of improving healthcare and innovation, we like to speak about patient feedback and insist that healthcare systems and organizations must start opening various channels to have constant interaction with patients all the time. So the development of better indicators is undoubtedly important, and initiatives like OECD Paris, which was mentioned earlier today, I believe, are important, but they're not enough in themselves. Now, in terms of patients' involvement in innovation and research, it's interesting, and I think EU has a role to play here. It starts from how we actually define innovation, because for patients, innovation means something that is not only new, but actually better than what exists now. We would like to see the EU support research not only into innovative products, which are important, but also innovative ways of doing healthcare and doing science, because including patients as partners in research is becoming widely accepted best practice, but it's not really yet implemented across the board. Many researchers still struggle with the difference between using patients as a resource and their experiences as data, and including patients as true research partners. I think there's a particular need to embed patient partnership in the digital space, perhaps because technology companies are not so well used to working with patients as, for example, pharma companies are. This can change, and it should change. The proposal for Horizon Europe emphasized the role of civil society participation in, and I quote here, in co-designing and co-creating responsible research and innovation agendas and contents. We believe the Commission should put this idea into practice, and in closing, I would suggest 2 concrete actions that can make a real difference. First, co-production with patients and with citizens where applicable should be an explicit precondition for obtaining EU support, and research consortia should have to demonstrate participation. But not only that, there needs to be a set of guidelines in place for best practice. This is the vital step to avoid patient participation being treated as a tick box exercise and to drive a real change in research culture. You can read more about EPF's use in our responses to the Commission's consultation on the data strategy, as well as the artificial intelligence consultation. I don't have time to go into those right now, but we in the patient community are hugely supportive of these efforts, and we would like to be involved in ensuring that patient partnership becomes a reality, and the EU can actually be a world leader in co-production of research and co-production of science. Thank you.
Thank you. This is very good.